You're driving right now, running through flashcards in your head for your Week 1 OB quiz. You're trying to lock in fetal heart rate patterns, preeclampsia protocols, and a dozen other clinical terms while keeping your eyes on the road. But here is the reality of maternal-newborn nursing. There is a massive hidden risk factor that determines maternal and fetal outcomes before your patient even walks through the clinic doors. The Social Determinants of Health maps conditions where people are born, grow, live, work, and age. Perfect clinical interventions unravel if patients return to environments without basic resources, directly driving infant mortality, prematurity, and low birth weights. To pass your OB quiz and eventually manage a high-risk unit, you have to treat these factors as invisible vital signs, applying the same clinical judgment you use for a pulse or a blood pressure reading. Let's break down the 5 SDOH domains like a clinical checklist. Domain 1 is economic stability. For a pregnant client who cannot afford healthy food, the clinical risk is nutritional deficiency, causing severe maternal anemia and fetal intrauterine growth restriction. Domain 2 is healthcare access and quality. A common barrier here is a client who lacks reliable transportation to reach their regular prenatal appointments. When patients miss these visits, they miss critical diagnostic windows. A lack of a reliable bus route can result in undetected gestational diabetes or failing to identify major fetal anomalies on an anatomy scan until it becomes an emergency. Domain 3 is social and community context. Picture a client working multiple physically exhausting jobs without any family support system to lean on. That severe psychosocial stress and chronic exhaustion elevate cortisol levels and trigger physiological cascades. This directly increases the risk of initiating preterm labor and places the mother at a higher risk for severe postpartum depression. These economic, logistical, and social barriers compound on top of one another. An everyday struggle to pay rent or catch a bus quickly accelerates into a clinical emergency. Domain 4 is neighborhood and built environment. This covers location-based risks like high air pollution or unsafe drinking water. Environmental hazards like lead or industrial chemicals cross the placental barrier, directly impairing fetal development and threatening pregnancy viability. Domain 5 is education access and quality, which heavily influences a patient's health literacy. If a patient cannot comprehend their postpartum discharge instructions, they may not recognize the early warning signs of an emergency. Delayed care for conditions like postpartum hemorrhage or an infection like chorioamnionitis can prove fatal. When environmental hazards and literacy barriers go unaddressed, they become just as dangerous to maternal-fetal survival as an untreated infection or a genetic complication. Identifying these 5 domains serves no purpose if the nurse does not act. This is where we shift from assessment to advocacy. You have to practice therapeutic, non-judgmental communication. You need to ask a patient if they have reliable transportation to their next appointment in a way that builds trust rather than causing shame. You act as the vital bridge to the community. That means connecting food insecure patients directly to nutrition programs like WIC or initiating a consult with a hospital social worker before they leave the unit. You can implement immediate clinical interventions for these logistical hurdles, like issuing clinic transport vouchers or setting up telehealth monitoring for patients who cannot travel. You must evaluate your patient's life circumstances with the same rigor and intense focus you use to monitor their electronic fetal heart rate data. Mastering these 5 domains transforms the Week 1 OB quiz from a memorization exercise into a functional map of your patient's actual life. This assessment is how a nurse identifies the life-threatening risks that clinical monitors simply cannot see.